Last week, the Institute for Civic Leadership hosted a breakfast featuring Dr. Wendy Wolf, President and CEO of Maine Health Access Foundation, the largest health foundation in the state of Maine. Over its 10-year history, the Maine Health Access Foundation has granted $36 million to over 250 organizations throughout the state. In a presentation, Dr. Wendy Wolf focused on the ongoing need for leadership in healthcare reform. Here are some excerpts from her presentation.
The topic, obviously, is can leadership save health reform? And the answer is yes. So we'll take questions right now. You know, for many years, I was a faculty doctor at the designated charity hospital in Texas. You see, healthcare is available to everyone in Texas, whether you are insured or not, at the University Hospital in Galveston. You just had to get to Galveston. Now, one day I was in the office. There was a young man in his early 30s. He walked in and he asked for me by name. And he was gaunt. He was a little breathless, and being a cardiologist, I kind of looked at him and I could see underneath his shirt the sort of incredible pulsation of his heart. This gentleman indeed needed surgery. And we did it. Now, here is a working class guy who didn't have health insurance. He has his own business. He's trying to take care of himself and his family. He wants to go back to work. But when illness strikes, he has to go, hat in hand, hoping that he can get care. Now, we can do better than this. We can do better than this as a country. We can do better than this as a healthcare system. Now, health reform gives us all the chance to do better for everyone, not just those with the means. Many Americans heard, particularly from politicians, oh no, we support reform, but we're concerned it's going to hurt the best healthcare system in the world. You know, our healthcare system is number one, but it's not necessarily because it's the best. Now, I do want to emphasize, if you look across the world in industrialized nations, the United States has been the only highly developed country in the world that does not have a system of universal access to care until we have the new law. In fact, nearly 47 million people in the United States are effectively shut out of our healthcare system because they're uninsured and they do not have access to affordable care. And you might think this is an issue that affects those who are just poor, but because of our Medicaid program, which is a federal and state program to provide health care to the poor, it actually is an issue that hits low-income working Americans. Our future without significant reform, I think, is even more bleak. This is data from the nonpartisan Kaiser Commission, and they released this analysis that showed in the absence of significant reform where we can rein in health care costs, the average premium cost for family coverage in 2019, all right, that's 9 years from now, that's not so far, is going to range between $24,000 and $30,000. If you're uninsured and you have cancer, you end up paying 2.5 more times out of pocket for your care, and frankly, you receive about half the level of care that someone with insurance receives. Surely you'd expect us to have the highest quality of care in the world, but I wish that were true. Compared to other countries in the United States, we have shorter life expectancy. Our health outcomes are below those of less developed countries. In fact, we're battling it out with Kuwait. And study after study shows that for an array of common conditions, we have about a 50-50 chance of getting the best care, which means the right care at the right time for the right reasons. So if quality isn't number one for us in the United States, there's only one aspect left, and guess what that is? That's cost. And in fact, this compares the United States. We are the clear winner on having the costliest healthcare system in the world, and this compares us to all the other developed nations, where you can see we not only spend more on healthcare in the United States than other developed countries, we actually spend a lot more than other countries.
Her full presentation will be aired on the Community Television Network, Channel 5 in the Greater Portland area, and on demand on our website within the next month. Please go to our website, ctn5.org, and do a search for Dr. Wendy Wolf for details and the video on demand after April 30th.